Can an illegal enema reverse cardiovascular disease, plaque, heart attack, and stroke? Take all that risk off the table? This is a video about Cavadex, Cavadex. We've had a lot of requests. It's made by a company named Colrem, probably a mashup of cholesterol remedies. Their website tells stories like reduction of angina in 2 weeks. Stories are great. I'm a scientist and I realize that statistics bore people to death. But stories really need to be backed up by good science. How is Cavadex supposed to reverse plaque? It's supposed to dissolve the cholesterol in the plaque, in the artery walls. Now, if you look a little bit harder at this enema, you'll see that it's not a Cavadex enema. I'm just too cheap to pay hundreds of dollars, maybe even thousands, depending on how much you get, for a video prop. This is a saltwater enema. Cost me about $2. But this enema pack may have a couple of things in common with Cavadex. Number one, it's inserted in your rectum. And number two, it may have about as much evidence that it can clear arteries. Ooh, I guess you can tell I'm not using it. And some personal information. I have plaque, cardiovascular plaque. I have my own story about it. But why am I not taking it? They say it reverses plaque, it dissolves it, and even if it doesn't, it's safe and harmless, so why not try it? What's the risk? So again, I reviewed it, and here are my thoughts. Cavadex is a form of cyclodextrin. It's a cyclic sugar or starch made from starches by bacteria and some other manipulations. Cyclodextrins are not new. They've been around for a while. I've done videos on these before. Though I think the last one was about 4 years ago. And again, unfortunately, I have to say about the same thing that I did 4 years ago. They're promising, but still not ready for prime time.
It's a chemical that's supposed to dissolve cholesterol crystals. And in fact, for some reason, it's supposed to help the body genetically gear up to dissolve cholesterol crystals. And not only just in plaque, but in the bloodstream as well. So everything sounds great. We've got a miracle drug on the way, right? Maybe not true. So again, here we go down the path of looking for yet another drug. I hope it works, but it gets back to the point. Lifestyle is medicine. Lifestyle is difficult, but it's safe. And let's focus on our lifestyle first and make sure that we've done everything we can before we try to bail ourselves out of a bad lifestyle with yet another medication.
Cavadex is beta-cyclodextrin. Some research has suggested that cyclodextrins in general have the potential to make cholesterol particles more soluble, making it easier for them to exit the plaque in the artery wall, and therefore reversing arterial plaque. There are 3 problems. The evidence, at best, is inconclusive for both efficacy, how well it works, and for safety. The second problem, it's based on an assumption that this is a cholesterol problem, and that's an assumption coming under a lot of fire as new evidence comes out. Number 3, the third problem is the drug delivery issue. It's a major problem for all the cyclodextrins. It's because they're starches. Starches get degraded by the stomach when they go through the stomach and small intestines. They get digested. They're metabolized very quickly, so we can't just swallow these things. So most of the research has been done using IV, sticking a needle, getting it directly into the bloodstream with a needle. IV is a non-starter for home use. Research models have used up to 18 episodes of IV over 36 days. That starts to sound like a hospital stay, or skilled nursing, or prolonged home nursing care. That's, again, a non-starter. No insurance is going to pay for that. So enter Colrem. Colrem's solution was, or is, an enema. Well, it makes sense. Expose the cyclodextrin, the Cavadex, to the intestinal walls, but bypass the stomach and small intestine. Maybe it's a little bit awkward But to reverse cardiovascular disease, who wouldn't do that? The problem is there's just so little evidence that it works. So let's go to the website. On the website, the makers of Cavadex say that the drug saves lives, and it's been improving health in those who've taken it for over 3 years. And some videos promise plaque regression in a month, 1 month. No angina, no plaque. It's evidently unclogging arteries. An occasional enema in exchange for clean arteries, again, sounds like something I'd do, and I'm betting I'm not the only one. But just to spoil everything, along comes the FDA. The FDA wrote a letter to Colram saying that this is an unapproved drug and is therefore illegal to be prescribed or sold in the U.S. as a medication for cardiovascular prevention. Got to give you a fine detail here. This is legal and it's being used for Niemann-Pick type C disease. This is a devastating cholesterol transport disease. People rarely live to age 30 if they have Niemann-Picks. They make it into their 20s. So there's a little bit of a difference on the risk-benefit equation here for those patients. Back to the letter. Kyle Hodgett's founder and CEO of Colram wrote his own letter, and it's there on the internet. He talks about he's just fed up. He's had enough with the medical industry, the FDA, supporting profiteering by big medicine and big pharma. His product, Cavadex, could decrease profits from so many medications, stress tests, cardiac echoes, cath lab costs, etc., etc., etc. Sounds like a really good thing, right? Well, so this is the big dust-up, and for those of you who are not familiar with the term, a fight or a brawl. Who's right? Who's wrong? It's interesting, and maybe what's even more interesting is who's going to win this. Is the FDA just a bunch of bureaucrats in the pocket of big pharma and big medicine, or did they misunderstand something critical? If they did, I can witness for you. It certainly would not be the first time the FDA screwed up. Or is Kyle Hodgett a profiteer, a modern-day snake oil salesman, or just a little bit misguided and overzealous to try to help people? I've had my own disagreements with the FDA, and pardon me, but we're going to go down a bunny hole there. It's important to understand, I don't just support the FDA on a lot of their decisions. I am on this one. The delay behind CGMs, continuous glucose monitors, that took years. The FDA said these were not safe, and meanwhile, Canada and European citizens were using them and getting incredible benefit for years. And I was screaming the whole time on my videos, and I'm not sure anybody wanted to listen, or at least they didn't listen. Thank you for your patience with me going down that bunny hole. The point is, I'm agreeing with the FDA on this one, on Cavadex, but I'm not a shill for the FDA. Cavadex is just a completely different situation. First, is Big Pharma trying to squelch this? I don't think so. I mean, this could be a great opportunity for Big Pharma. They've got plenty of dollars. They could buy the patent from Colram, or even better, recreate their own version of a cyclodextrin, and squelching it is just not going to work. There would be too many other big pharma with big money who could do this, who are going to go after the opportunity, assuming it's actually there, because that opportunity could result in mega bucks. But nobody's touching it. Why? Maybe they see a bridge too far, just like I do. But are you still tempted to go to the Colram website, enter your credit card number, and pull down your pants for that enema? Before you do, let's go a little bit deeper. The first claim to consider is that cyclodextrin is safe, or Cavadex is safe for humans. Here's a paper published in 2013. Remember I mentioned Niemann-Pick type C disease a few minutes ago? The devastating disease, most people don't live to their 20s, let alone their 30s. This paper involves a few patients with that disease and showed relative safety, at least compared to Niemann-Pick. Like many, I suspect Cavadex and the other cyclodextrins will turn out to be safe overall. If you're ready to take your chances on safety with this, let's go back to clinical trials. Clinical trials are trials of new medications, new procedures, new treatments. They're notorious for massive bad surprises. Let me give you a few examples. Adderall XR, it's for ADHD, heart and brain damage. Lotranex, for irritable bowel syndrome. It worked great until it started rotting out colons. Oraflex, a nonsteroidal anti-inflammatory. Again, it worked great until you started seeing severe liver damage. I'm not going to belabor the point. If you're interested, just Google drugs withdrawn after market. So that's it for safety. I'm not going to go any further on that. Let's just ask the question, does it work? Let's go to what we call efficacy. Does it work? Here's the next claim. Cavadex removes arterial plaque in mice. And that appears to be true, but there's still a couple of problems. The first one, Cavadex was injected. It wasn't given by Enema. The second problem is that mice are not humans. So is it too much to ask to see evidence for use of Enema in a human? Here's an article published in October 4th of 2024, very recently. It seems to suggest that Cavadex reverses arterial plaque. In one human subject, using coronary CT angiogram, it looks like there's plaque reduction. Coronary angiograms, or angiography, is one of the most popular methods for demonstrating plaque. It involves injecting dye, X-ray dye, contrast dye, into your leg or arm, and then a CT scan to find plaque in the artery and to map it out. Again, as you see on the screen here, the images look great. It's expensive and invasive, but if your goal is to see a clear image, that's the way to go. Unfortunately, this study also appears to have some challenges. The first one was, how many patients were involved? 1. That's right. Now let's discuss N of 1 experiments. They're popular. I use them. I did an experiment a couple of weeks ago. We did a video, and a lot of people were very interested in it. But drawing conclusions from other people in an N of 1 study can be a stretch. They're great for raising questions and hypotheses, but to assess what's going to happen to thousands or millions of people when they take a treatment or an intervention, it's not, N of 1 is not the way to go. Let's get back to the CT angiogram study done on one person showing plaque reversal. They applied about 18 IV injections of Cavadex in a 36-day period. Again, IV, straight into, mainlined, right into the bloodstream, not an enema. So even if the IV treatment might work, that doesn't mean that the enemas will. And worse, we don't know if it can cause unknown side effects. But I promised I'm not going to go back to the safety issue. Here's the third flaw, unclogging arteries. That doesn't look quite as convincing to me as it might to you, at least first blush. They look great, and they show the images. You can see some decreasing plaque, or what looks like to be decreasing plaque in the right coronary artery. But let's look at the measurements. So they report 60 to 70% blockage on the first image, but a no clear assessment on the second image. No description of the radiology report. And obviously, as a scientist who's gearing and looking for evidence, I'm still left wondering why. But at least there's finally a study on a human. Oh, and I guess that's part of the problem. As we mentioned, one human, singular. Another paper published 1 month earlier, September 26, it concludes that the research on cyclodextrin shows that it reduces carotid plaque. That is, plaque in the arteries of the neck. But again, we have those same flaws showing up yet again and again and again. One subject, injected treatment, IV, not enemas, and CIMT report doesn't really show that much change on plaque size or type. CIMT, if you haven't heard of it, it's a test that we use to find soft or dangerous arterial plaque, inflamed arterial plaque. Plaque is stable unless it's soft and inflamed. CIMT stands for Carotid Intima Media Thickness Test. The intima and media are two layers of the artery wall where plaque tends to reside. So if you look at the thickness, you're beginning to understand how much plaque you have. Now, in an ultrasound, there's no radiation. It's not invasive. It is a great way to find arterial plaque and to measure it. It can be hard to find an expert to do it, though. More information about this test and my own plaque reversal story in a video, we'll provide a link at the end. So based on that evidence, I don't see how they can claim it reversed carotid plaque. Claims that the enemas will work in general. You'll see that on the website. They claim that 25% absorption rate comes from an enema of Cavadex. Well, that's actually a big challenge too, and here's why. If it's 25% absorbed, it means it gets to what we call the splenic bloodstream. That's not the bloodstream where the artery plaques are going to be. That's the bloodstream going from the GI tract, the intestine, up to the liver. So it's going to have to pass through the liver first, where the liver will knock out another 50%. So instead of 25% actually having a chance to reach the arteries, the true amount will still be closer to 12.5%. 12.5%. And that's being optimistic. It's back to that key issue with all the cyclodextrins. How do you get the cholesterol into the bloodstream safely and effectively? Can there be a better way? Well, in June of this year, there was a paper that showed a new mechanism. It's not as new as you think. Theoretically, it's been around for a while. It showed promise, and it's called Nano assemblies. You know where that's going. Nano assemblies. Again, to quote myself from 4 years ago, they're just not ready for prime time. The last piece of evidence about the effectiveness of Cavadex is on the manufacturer's website. They show a case of Dr. James Roberts, one of the main promoters of Cavadex. He reversed his own plaque using Cavadex, and he tells the story. Now, as I said earlier, I agree with having stories. Even though I'm a scientist, I can recognize most people are bored by statistics, but stories need to be backed by good evidence, or they can misdirect a lot of people. The assumption that Cavadex will fix heart disease regardless of lifestyle is a big mistake. Similar to stents, this can lead to relying on a drug or an intervention like a stent instead of making the necessary lifestyle changes. And if you've seen one of my videos, just one other, you've probably heard me say somewhere in there, you cannot out-stent, out-supplement, out-bypass, out-prescribe a lifestyle problem. And in this case, you can't out-Cavadex or out-Enema a lifestyle problem. Here's one last thing on why I'm skeptical about Cavadex. When you study arterial plaque and heart attacks, you'll realize that even though cholesterol does play a role, an important role, it does not appear to be the major risk factor. This whole Cavadex house of cards is built on the assumption that cholesterol is the primary cause of plaque and heart disease. That assumption stretches back to Ancel Keys and even beyond. Ancel Keys, in case you don't remember, is the guy that we have to thank for making cereals and other grain products the base of the U.S. food pyramid. And if you haven't heard about that yet, you probably haven't heard about his research, that the 7-country study, that was flat wrong. Some say he cherry-picked his data unethically. Others say, well, he was just wrong. That's a debate for another time, another video. Let's go to the core question here. Do you actually need to remove cholesterol to stabilize your plaque and therefore reverse your cardiovascular risk? And the simple answer is no. Now, the first guys to discover this were Paul Ridker and Gavin Blake. They looked at studies like Waskoff's Jupiter trials and other things and noticed that it didn't seem to matter how high your cholesterol was in terms of your cardiovascular risk. What did seem to matter was cardiovascular inflammation. And again, inflammation, I'm not telling any new stories. There was a Time magazine cover article, 20-something years ago, saying inflammation is the major cause of heart attacks and strokes. And a bunch of other things. And the medical community seems to still not have caught up to that fact. Plaque stability is more important for risk than removal of cholesterol. And in fact, removal of cholesterol has very, very little evidence supporting it at this point. That all sounds theoretical. Let me give you a study. It's called the Honda study. I talk about it quite a bit when I'm seeing patients. It gets back to that CIMT, the carotid intermediate thickness test, and it shows a few things. First of all, it shows that this is not subjective, this is objective. They use optical character recognition to demonstrate level of calcification. They use Kaplan-Meiers. There's like a life table analysis to show how often people had cardiovascular events. After the patients stabilized, it was really clear. They were stable. There was no risk for cardiovascular disease. They had about the same risk as people with no plaque. But the people that were not stabilized, who had plaque that was not calcified, continued to have risk for cardiovascular disease. Even plaque reversal maybe doesn't have much to do with cholesterol. The director of cardiology at Harvard made the point that we've had plaque reversal happen before. That's nothing new. Many cardiologists say it doesn't happen. Most doctors say it never happens. It's just because they haven't seen it. Now, here's what he mentioned. Weight loss, like 30-pound weight loss, is the most common place to find it. But you can also see it with, again, statin use. As we said before, Ansel Keys was not alone. Most people still think cholesterol is the major cause of cardiovascular disease. Why is that? Cholesterol in the artery means cholesterol in the blood and cholesterol in the diet. Again, at least according to Ansel Keys and most people. Ansel Keys' failed assumption about diet is finally dead after many decades. But the assumptions about cardiovascular plaque and blood levels of cholesterol are taking longer to die. They still appear to be on their way out, though. Here's one of the problems with those assumptions. The first misperception involves cholesterol. LDL is actually not cholesterol. It's a particle called lipoprotein. Lipo meaning fat, protein meaning protein. Again, a little bit of geeky stuff, but we can get over that. Lipoprotein is a particle made of fat and protein. That's what it is. You see, when we eat a salad with olive oil dressing, or when we eat a steak, when you eat anything with fat, that fat doesn't mix with the water in your bloodstream. So your body creates a protein because you need a way to isolate that fat from the water. If you don't, it'll form a big blob, and that can be lethal. These big blobs of fat are called fat emboli. People are known to die from that, and it happens with major trauma like a car wreck where the pelvis or the femur, the large bone of the leg were broken. So let's go back and talk about lipoproteins just a minute. So those proteins that carry these fats, there are some that carry mostly cholesterol. That's HDL and LDL. There are others that carry mostly triglycerides. That's, again, some geeky terms, IDL, VLDL, chylomicron remnants. Here's the thing. There's really no debate that the triglyceride particles are far more closely linked to cardiovascular disease, cardiovascular plaque, and disease risk. In other words, the proteins carrying triglycerides are far more associated with risk than the proteins carrying cholesterol. Why is that important? Triglycerides are a marker for prediabetes. Prediabetes is a much stronger driver of cardiovascular disease than cholesterol alone. Now, do I sound like I'm ranting from a mountaintop? Who cares? Why is this so important? Why do we continue this debate? This is far worse than just a cholesterol traffic jam. Here's why. Thinking that cholesterol or LDL is the problem leads to a reliance on medication. I'm not saying anything outlandish here. Lifestyle is the solution, not pills or stents or enemas. One of the biggest tragedies of our current medical system is an over-reliance on drugs and stents for a lifestyle problem. When you think about that, it should become clear that it's metabolism, not cholesterol, that caused the problem in the first place. Cavadex goes back to assuming this is a plumbing problem. Cholesterol stuck in there alone is not the problem. It's the inflammation caused by the metabolic disease, the prediabetes. Now, what causes that? Aging, obesity, and, wait for it, lifestyle. And yes, genetics play a role. Genetics may load the gun, but lifestyle pulls the trigger. At the end of the day, this is a lifestyle issue. So let me repeat, this is not a plumbing problem, it's a metabolic problem caused by differing levels of aging, genetics, obesity, and lifestyle. It's not caused by a deficiency of statins or PCSK9s or a cyclodextrin enema. Even though, yes, cholesterol can trigger some inflammation, it's just not LDL that causes that. It's another major problem that we're refusing to see. It's called metabolic disease or prediabetes. Why are we refusing to see it? Why are 90% of the people that have it totally unaware? Because their doctors are unaware. Again, I'm not making these numbers up. They're there in the statistics. By the time we're age 18, over half of us have prediabetes. By the time we're 60, more like 80% of us do. And 90% of us that have it don't know it. Oh, I've had a test by my doctor. He says I'm fine. That's the problem. 3/4 of doctors don't know how to diagnose this. And again, I'm not making that number up. That's in the surveys as well. So if your doctor doesn't know how to diagnose it, how would you expect to know about it? Let alone treat it. The bottom line is that I just want to give you more perspective before trying this new drug. If you want to try Cavadex, go for it. If you already did, then let me know in the comments. And don't blame me for encouraging you because, again, I think my interpretation is it may be not legal for you to do that. Anyway, if you did try it, let us know. I'm very, very curious. I'm interested in knowing about your experience with it. So, at this time, I'm concluding that Cavadex is an unproven drug, and like other drugs, it'll probably never be the answer for cardiovascular disease or metabolic disease, like undiagnosed prediabetes. I actually hope I'm wrong. I'd love to see a pill that fixes this whole problem. I'd even take an enema. I did reverse my own arterial plaque, and I didn't rely on medications to get that done. Check out how I did this in the video right here. Oh, and the other video about eggs, the egg experiment? I guess that's going to be here. It depends on where Jesus puts it. He likes to make fun of me with these things.